Botox is more popular than ever in the fight against lines and wrinkles. In fact, more than 3 million people got Botox injections in 2006 alone. While many are satisfied with the results, some patients still see noticeable lines between the brows. Dr. G.J. Verret of Innovations Facial Plastic Surgery is here to tell us about an alternative to all this. Good morning to you.
Good morning. Thank you.
Why do we get these fine lines?
Well, fine lines between the brows are due to one of two things. They can either be created by actions of two muscle groups between the brows, like when you forcibly frown. Botox does real well for that by paralyzing the muscles. The other cause can be because of tethering of the skin to the deeper structures, and that's when people are just have the lines at rest or even after Botox. And it's important because, you know, from a very young age, we're taught to look people in the eyes. And do you know what the left eye said to the right eye?
No, what did the left eye say to the right eye?
Between you and me, something smells. So it's very important what's, exactly. So it's very important what's between our eyes because it kind of gives an idea of how we're feeling. And some people can erroneously give off the impression that they're angry because of these lines.
Right, because when I'm not smiling, I just carry a frown. So because of the weight, I don't know. Just because of the way I was born, I guess. But let's talk about the alternative then to Botox, or the supplement to Botox, if you will.
Absolutely. We call it the SurgiWire Wrinkle Wipe, and it's really designed at those lines that are present at rest and also at the end of Botox. And what you're seeing here is actually the device itself, which is a metal wire that we use to release those attachments of the skin to the deeper structures.
So it's actually a wire that it stays in the skin?
No, actually, and that's the procedure itself actually uses that wire to release the attachments of the skin to the deeper structures.
You have some animation of this procedure being performed. Let's take a look at that and explain to us what's happening on this, if you will.
Absolutely. Well, what you're seeing here is the lines between the brows. The SurgiWire, the ends of it have little needles that are inserted underneath the skin, and the wire goes on either side of the wrinkle. You pull the wire back through, it releases those attachments, and it smooths out the skin. This is done in the office under local anesthesia, so it's a pretty easy procedure to be done. And then I also take a little piece of deep tissue from above the ear to prevent that scar from reforming.
Is there bruising afterwards?
There can be, and that's the $64,000 question. In any cosmetic surgery, there's always a risk of bruising. Generally, though, with this procedure, the bruising is pretty minimal. Most folks return to the office the next day without much of a problem.
I have to tell you, that looked painful.
It's not. It's not. Once you numb things up, you don't feel anything else.
Okay.
And the numbing is just like getting a shot when you go to the dentist.
How long does it take? Just an office visit?
Just an office visit. Yeah. You know, by the time we get you numbed up and everything, maybe about a half hour. Okay. But that's about it.
You've got some before and after pictures. Let's take a look at those.
Absolutely.
And see the result, because that's the proof is in the pudding, right?
Absolutely. So here you see before and afters, and you can tell this person on the top has the lines between the brows, and in their after picture, they're gone. These photos are taken several months after the procedure. The SurgiWire has only been out for a little over a year and a half, and so we don't know what the 10-year results are going to be. But the early results are very promising. It looks to be a permanent procedure, really.
As we look at a couple more, how long do the results last?
Yeah, you know, that's the thing. These photos are from several months after the surgery. We have pretty much good 1.5-year follow-up, and the results have remained throughout. And just based on the design of the technique, it's really designed to be a permanent procedure.
Other than the brow area, is there any other use for the SurgiWire?
Absolutely. It can be used to decrease the tethering of skin. For example, in the nasolabial folds, this area between the nose and the corner of the mouth, can also be used for some acne scars as well.
How long has this been used?
The SurgiWire itself was introduced just over a year and a half ago now, and so it's been in use kind of since then, and has some growing popularity. You know, not everyone wants the Botox, and for some people it doesn't work for lines that are present at rest, and even some people have lines after Botox.
Very interesting. All right, thank you so much.
Thank you. I appreciate it.
The Innovations Facial Plastic Surgery is located on Preston Road in Plano. For more information, log on to innovationsfps.com or call 972-608-0100.